Hello, my name's George and I live with dementia, early onset dementia. I was diagnosed age 63 and now 67. This is one of a series of film talks that I'm planning in order to provide a resource to people, whether they be staff in healthcare or social care or just general awareness raising. To do with what matters to people living with dementia in various situations. So today I'm going to talk about what matters to us when we're in hospital. So, what matters to patients in hospital who live with dementia? Last year I carried out, on behalf of the Shropshire, Telford and Wrekin Dementia Action Alliance, a survey of people's experiences, people who live with dementia and those who provide unpaid care for people with dementia. It was in Shropshire and Telford and Wrekin, and we had 30 responses. So, what did people say about their hospital care? And it was about other things as well, but in particular hospital care now, today. Many staff, this is what they said, many staff in hospitals do not understand dementia or how to work with people living with dementia. Staff do not understand language difficulties or how to deal with them. The "This Is Me" leaflet was not looked at, just filed. Staff didn't introduce themselves or find out about my likes and dislikes. My dad was repeatedly ignored when he asked when he was going home. His bed space was changed, confusing him further, and he couldn't find his way to the toilet. My medication was not administered to me correctly. And those are just a few of the comments. So let's think about what matters when a person with dementia is in hospital. You need to know where you are. Everybody does, but for most people it's obvious. But if you can't recognise your surroundings or work out what they mean, you feel frightened, lost, and you might even feel you've been kidnapped. In a strange place, you don't know how you got there. You need to know why you are where you are. It may be difficult or impossible to process what you hear, to place words into a context that is meaningful. If you have a short-term poor memory or poor short-term memory, you will forget what you understood a few seconds or minutes earlier. So you'll ask where you are again and again. If someone asks you, like a doctor on a ward round, if they ask you, how's your pain today compared with yesterday? Well, a person who can't remember yesterday can't answer the question, so it's really a silly question to a person with dementia. If you can see the name of the hospital, the month, the day and time from where you are in a hospital, from your bed, you may be able to orientate yourself. Remember, a short-term memory of, say, 15 seconds, which is by no means uncommon, means you need to be able to see and read this information wherever you are every 15 seconds. So it's got to be visible. A stranger wrapping a cuff around your arm, which then inflates and hurts, that's frightening and painful. And you may not know why it's being done to you, so you need a gentle, kind explanation from a person who sits at your level, looks at you when they talk, and holds or strokes your hand if you're anxious, and waits till you're ready. If your bed is moved, whether to a neighbouring space in the same ward or to a different ward, you may once again feel lost, frightened and kidnapped. If this happens at night, which it often does, the disorientation is colossal and disabling. I remember 15 years ago spending an awful night on a ward beside a man brought in late in the evening. He shouted and cursed all night, shouting that murderers were after him and lashing out at any staff near him. He was, however, simply responding logically to a situation he couldn't understand. He was literally in the dark, in a place he did not recognise and assumed that people were going to kill him. The brain disease underlying dementia causes different symptoms in every person. We are, every one of us, different individuals, and the biggest mistake anyone can make is to assume that anyone with dementia is the same as anyone or everyone else. The This Is Me document contains vital information about your likes and dislikes, your life history, your family and friends who care about you. Do you like tea with milk? Do you drink it out of a big mug or a dainty teacup? What were your jobs during your life? Where did you grow up? What music do you enjoy? This information enables staff to connect meaningfully with a person who may not be able to tell you that information themselves. The patient with dementia may be living in a distant land in their heads, but they may, and usually do, remember their childhood and early working years as if they were yesterday. You can connect with them by using this information. And a person who is used to drinking pint-sized mugs of tea will not take well to little plastic cups. I'm not sure who would actually. So they will not drink, and they will dehydrate, and they'll become more ill. And if you ask them if they've had a drink, they'll probably say yes, even if they haven't, because they want to please you. So use the This Is Me information, put it on display beside the bed. Don't lose it, don't file it, and send it with the patient when they return home. Our survey showed that many staff do not understand dementia, nor how to respond to and work with someone living with dementia. I wonder if we should be surprised by that. Staff at my local acute trust have 45 minutes during induction about the butterfly scheme, John's campaign, and using the This Is Me leaflet. So how would they have any understanding or insight into how dementia affects people? They're just told how 3 schemes work. Not why they matter, not how to deal with a patient who asks the same thing every few minutes, not how to work with a patient who needs to walk around or who is frightened or who cannot understand. The Dementia Friendly Hospitals Charter says that staff who work regularly with people living with dementia should do level 2 or tier 2 training as set out in the Dementia Core Skills Training Framework. But it's very obvious that few people here or anywhere else do this. Given that 30% of inpatients in any hospital have dementia, you would think this would be a high priority. And it seems to be common practice now to regard Dementia Friends awareness sessions as sufficient training, but it absolutely isn't. It is not acceptable. So hospitals, there's a lot you must improve on. I know you're overwhelmed, I know you have too few staff, but we only have one life. If we had cancer, you would not ignore our needs. There are things you can do to make life better for us, to help us get better more quickly, and to treat us as real, living human beings. Thank you.